Hi, I'm Dr. Carruthers. I'm a breast surgeon with Comprehensive Breast Care Surgeons of Holy Redeemer, and I'm the Breast Health Program Director at Holy Redeemer Hospital. I wanted to talk to you today about what to do if you are diagnosed with breast cancer. Women who are diagnosed with breast cancer, obviously it's a very emotional time when they're first diagnosed. And for our patients, we typically do give them their diagnosis over the phone so they can be prepared when they come into the office to speak with us. Obviously, when they hang up the phone, a lot of them do fall apart. They try not to fall apart when they're talking to us, but we know what happens after they hang up the phone, and then they are kind of hit with this, well, what do I do now? And at that point, what we really do recommend is when you come into the office, it's nice to have, some people like to go on the web, some people don't. If you do go on the web, there are a couple websites that we recommend, a lot of websites that we don't recommend. One thing I really don't want people to do is just Google breast cancer. You Google breast cancer and you're gonna get all these really horrible stories of bad things that have happened to people, and a lot of them really have nothing to do with your diagnosis. So one thing that's really important to do is go on a really good, respectable website. Our website is actually very good, comprehensivebreastcaresurgeons.com. Other websites I recommend are the American Cancer Society, and then there's one other website that's very good, and that's breastcancer.org. And what those websites are going to do is they're going to give you a little bit more information about what breast cancer is, what the possible treatments are, and it's really good medical information that's easy to understand that allows you to have a better understanding when you walk in the office about questions you might have. Another thing that's really important to do when you come into the office is to bring someone with you. So sometimes people come in and they don't have any support person. Maybe they haven't told anyone yet, but it's really nice to have what we call a second pair of ears to listen so that when we say something that might make you start thinking about other things, there's someone else actually listening to what we say. Then at the end of the visit, we typically write everything down, but then you have a time at the end of the visit where you can sit down with your friend or your partner or your son or daughter and say, what did she really say? Did I hear this right? Did I hear it wrong? And understand a little bit better. So those are the main things that I really recommend. The other thing is just take a really deep breath. You're going to be fine. Really, most breast cancers, thankfully, are caught early. They're very treatable, they're very curable, and we can have a really good outcome. So don't freak out. Don't lose it immediately. Let us talk to you. Let us explain what's going on so that then you have a better understanding and you can really find a path forward.